The history of medicine is often a story of shiny steel scalpels and high-tech lasers, but one of our most effective surgical tools isn't made of metal. It has a pulse, 6 hooks for a mouth, and a voracious appetite for dead flesh. To understand the gross and glorious world of maggot therapy, you have to look past the ick factor and see these creatures for what they truly are: nature's most precise biological surgeons. Long before we had FDA-cleared medical devices, soldiers on the battlefields of the Napoleonic Wars and the American Civil War noticed a bizarre phenomenon. While many wounded men were dying of gangrene, those whose open sores had become infested with blowfly larvae were actually surviving. Their wounds were clean, pink, and healing. It was a gruesome miracle that hinted at a sophisticated medical partnership we are only now fully mastering. So how exactly does a fly larva become a licensed medical practitioner? It all comes down to their incredibly specific diet and a process called extracorporeal digestion. Unlike us, maggots don't have teeth to chew their food. Instead, they flood a wound with powerful digestive enzymes that liquefy dead, necrotic tissue into a protein-rich soup, which they then slurp up. The genius of this process is their selectivity. They lack the enzymes to dissolve healthy, living human protein. This makes them a microscalpel, far more accurate than any human surgeon. They can navigate the microscopic crevices of a deep wound, removing every atom of decay while leaving the healthy tissue completely untouched. But the maggot's contribution to healing goes far beyond just cleaning the plate. As they move through a wound, they act as a living pharmacy. They secrete antimicrobial molecules that are devastating to superbugs like MRSA, which have become famously resistant to our strongest laboratory antibiotics. Furthermore, their physical movement and the ammonia they excrete actually change the pH level of the wound, shifting it from an acidic, bacteria-friendly environment to an alkaline one that encourages human cell growth. They aren't just cleaning the floor of the wound, they are effectively painting the walls and prepping the entire site for a total biological renovation. In the modern era, we don't just scoop these larvae out of a trash can. Medical-grade maggots are a highly regulated, sterile medical device. They are raised in controlled laboratories from disinfected eggs to ensure they don't introduce any new pathogens into a patient. Today, they are often delivered to hospitals in biobags, essentially tiny, breathable tea bags that contain the larvae. This allows the enzymes to seep out and the liquefied tissue to seep in without the patient ever having to see the surgeons at work. For patients facing the terrifying prospect of amputation due to chronic diabetic ulcers or non-healing bed sores, these tiny creatures are often the final, successful line of defense. Ultimately, maggot therapy serves as a humbling reminder of nature's ingenuity. While we spend billions of dollars trying to engineer the perfect synthetic cure, we occasionally find that evolution perfected the solution millions of years ago. These wiggly, iridescent pests have been saving human lives since the dawn of history, proving that in the world of medicine, sometimes the smallest, most unlikely heroes are the ones who get the job done best. The next time you see a blowfly, remember, you're looking at the parent of a tiny, life-saving surgeon that has been cleaning the uncleanable for centuries.